And I'm the Chief Executive Officer for Peaks Recovery Centers here in Colorado Springs, Colorado, and I'm joined today by my two fellow colleagues, Jason Friesma, one of the therapists in our program, and additionally, Clint Nicholson, also a therapist within our programming. So hopefully to bring your two brilliant clinical minds together to help answer some of these questions that I have top of mind today. So thanks for being here.
Glad to be here.
Thank you for having us.
Yeah.
Absolutely. Yeah. We all know I forced you guys to be here. So.
You did. That's
Yeah,
fair. You can do that.
Yeah.
You have the capacity.
As the chief executive officer.
Okay.
Yeah.
All right.
Yeah.
Feel good about this so
I
far.
do. So far, it's good. Yeah.
So recently I've had the opportunity to join the admissions department to support them as we've built additional team members or added team members to the team in that regard. And so I've been able to engage in front-end phone calls coming into Peaks Recovery Centers. And one of the things that I'm just fascinated by in answering these phone calls is that the phone calls aren't generally addressing major issues on the forefront of treatment, you know, that my son's suffering from addiction or these sorts of things. It's often, I'm looking for treatment that lasts for 90 days or 60 days or 45 days or 30 days. And for me, that doesn't mean a whole lot in my experience in working in addiction treatment, and sort of just curious from that clinical lens what that means to you all, or maybe what is trying to be expressed in that moment.
Okay, good question. I mean, I suspect people are trying to express that they're desperate for help and as much help as they can get. And certainly in addiction treatment, I think it's been pretty well demonstrated that the longer somebody is in some form of care, some level of care, the more likely they are to remain sober for the long term. Now, that doesn't mean that people need to be in, say, a detox level of care for 60 days or 90 days or even residential level of care, but I think what parents are asking for is like, I think they're saying this is really bad and we need a lot of help. That's my guess.
I agree with that. I also think it speaks to the the sort of lack of understanding and knowledge about what actual addiction treatment is. You know, these ideas that, you know, the fact that they're hanging on to a time frame rather than to content or to actual programming. I think it comes from a place of fear, but it also comes from a place of just not understanding and a sort of lack of education, generally speaking, about what we do in addiction treatment and what that actual sort of programming looks like for their loved one. So I think it kind of speaks to both of those sides.
Yeah.
Well, I think, Brandon, we've talked before, like the 28-day model, it's not like that was a clinically based length of stay for residential care. That was fairly arbitrary designation for a treatment episode, if you will. And certainly I think it's becoming increasingly common knowledge that just going somewhere for 28 days and then going back out to the same environment, that doesn't tend to work very well. However, allowing somebody to kind of start at a high level of care and then work their way down to lower levels of care usually can provide kind of a longer length of support and accountability for individuals.
I mean, I think that's those steps of care, though, like we have access to that information and that knowledge because we're part of the industry. I think for families, though, it's just this, we know that 28 days doesn't work, so, well, that means, you know, if it's 90 days, you know, there's that much more opportunity for whatever is going on to work. But there's still this idea of, I will send my loved one off to this sort of, this magical space where they will get healed and they will come back the person that I remember them, or the person that I want them to be, or the person that they want to be. But the reality is that that's not what the process looks like. You know, there is this sort of, these sort of levels of intensity and this sort of gradual building back into the community that a person has to go through while they're in the treatment process. And the reality is that 28 days, that's really just a pretty long detox, right? But the recovery hasn't even truly begun at that point. It's really, at that point, it's just a matter of, I'm not using substances in this moment, but I haven't actually started a recovery program.
Yeah, and certainly in our experiences working within addiction treatment, you know, one of the things that comes through the phone next is this array or a history of this array of diagnoses. My son or daughter suffers from severe alcoholism and major depressive disorder and type 2 bipolar disorder. the nature of addiction is itself is quite complex, but then it has all of these mental health components alongside of it. So what can we tell families, maybe about the order? Are we starting with substance use disorder first, those craving states first, before we can even peel into depressive states, or working on those mental health states? But what can we tell families in that regard about the order of that process and the most efficacious approach to, sort of calming those diagnoses concerns over what is a fairly short episode within treatment? So for example, one of the things I think we've talked about, at least at some point, cognitive behavioral therapy as a practice in the direction of curing a major depressive episode. In the evidence of it, it can actually do a lot of good over a period of 3 to 4 months. But Johnny's only interested in treatment for 30 days. And we need 3 to 4 months just for the major depressive disorder. But he has this severe addiction on top of it. It seems wildly inappropriate to think that we can resolve all of that within these limited timeframes, even a 90-day episode. So where do we start?
I mean, that's a great question. And obviously, there tends to be, at times, with a fair amount of people, there needs to be some sort of medical evaluation and intervention with medication. I am always a little bit suspect when people walk in with, not suspect, that's the wrong word, but when people walk in with kind of a laundry list of diagnoses, to me as a counselor and just how my brain works is I kind of set that aside and then I just try to meet the person where they are. And oftentimes, diagnosis sets, if you will, are adjusted even just weeks into a treatment episode because either new things emerge or the mood dysregulation was in a large part due to the substance misuse, or vice versa, or other issues begin to pop up now that the effects from the drugs are wearing off. And really, I think your question too is like, how do we address these things with families? And I think it's learning about an entire client or person, I want to say, actually learning who they are and what is driving the addiction and mental health stuff. With the background of our clinical knowledge that some of these things are probably going to require medication, some of these things can be dealt with in therapy, and then some of these symptoms and traits might even resolve themselves just with some sobriety and healthy nutrition and good sleep hygiene.
Well, I'm going to take this a slightly different direction.
As we do.
Yeah,
Yeah.
as we do,
Yeah.
yeah. I think the idea of substance abuse or addiction somehow being different than a mental health diagnosis is the first fallacy.
Yeah.
So really actually starting there and explaining to families that, addiction is a mental health diagnosis. Like they are one and the same. To be able to say that we're going to start working on this one but not this one is not actually real. Like the whole person is what we start with. Like Jason mentioned, you're going to meet the person where they are, and then that's where we know we're going to go. So really, I think educating families in particular, as far as like, look, there is no real difference between these two types of treatment, and I think the industry is kind of over time has sort of wisened up to that the way that we treat. Besides pharmacologically, the way that we treat addiction from a behavioral health component and the way that we treat mental health from a behavioral health component are really similar. There's not nearly as much distinction as we thought. At the same time, it doesn't change the fact that in 28 days, we're only going to be able to get so far. In 90 days, we're only going to be able to get so far. And I think it actually helps to frame in a more realistic terms, this idea that just like you can't cure or get rid of depression in 90 days, the same is true for addiction. So I actually think by drawing those two more closely together, it helps to sort of get rid of some of the, the myths that have come up regarding what addiction is, what addiction treatment looks like, the timeframes that exists in. So,
Well, I think, to your point, in those first few weeks or even couple months, I think a fair amount of the work is about helping people get some symptom relief, and then truthfully, I'll just be the therapist here, like give them some hope that like things are progressing, and there's a way to keep progressing, and there's a way to continue to experience greater relief and greater
Absolutely.
Adjustment to life and more ability to function, or more ability to connect with others, or more ability to just feel comfortable in one's own skin. And so I think it's such a process, and these diagnosis sets and diagnosis sets aren't even perfect. Like they're the best description we have, and there's overlap, and there's differential diagnoses, and how do we distinguish all of that? And good diagnostic work is important, but it isn't complete. It's not a complete picture of a person.
Absolutely.
Yeah. So, for the sake of time for this show, maybe we can only cover 3 bullet points today. But one of the major things that I, heard a lot in my time being back on the admissions line was that, Johnny or Sally's past treatment episode, it didn't work. And the frustration about that, and it seems like behind the veil there's, some sort of excusatory lens going on for a different episode. But at the same time, what do you hear as clinicians when you hear, the clients now in front of you, for the first time, walking you through sort of what has brought them to Peaks Recovery, and then they say something like, the last treatment center didn't work for me?
Yeah, and I think I used to really maintain a very similar mindset to that, and the more I do this work, the more I really sense that didn't work. What does that mean? Actually,
Exactly.
A lot of people who have been to 6, 7, 8 treatment, they actually have a lot of knowledge.
Right.
They actually, I sometimes even joke that they could probably even facilitate groups or do an education on something, and oftentimes I'll ask them to do that. So it isn't like it didn't work, like there's some knowledge in there, but there's just a component either missing, because that's a little bit of maybe even some shaming talk that something didn't work. I've never seen somebody that's gone through a couple rehabs that can't at least have a little of that hope that I was just talking about, that's like, okay, I got some traction, but something fell apart, or like I just need a little more help to figure out what happened.
Yeah, I agree with part of what you said as far as what I hear is there's an expectation that wasn't met. Not that a treatment didn't work, but there was an expectation that wasn't met in treatment. Again, I think that there's this idea that the treatment is the actual recovery, like the actual programming is what's going to bring the change, and it's not. Like it's just it's the spark, right? That's all it is. But if there's no kindling there, then there's no fire that's going to start, and we end up, and then I guess you just end up blowing a lot of smoke, right? So I think that with clients who have been through this process over and over again, and with families who have this idea or this perception of things not working, a great place to start is, what is your expectation for treatment? And us being really clear about what we are offering and what we are doing and what these outcomes are actually going to look like, rather than sort of, kind of feeding into this idea that, again, we're going to be able to sprinkle some magic recovery powder and people will leave ready to go.
Right. Yeah, and so, for me in closing, it's a reality that we have to have this time extension within treatment. It takes a long time to quell those craving states. I think the studies point at a 50% reduction in relapse after year 1, and 85% chance of success after year 2, and by year 5, I think it's less than 5% chance that you're relapsing in the process. So, but we don't have 5 years in addiction treatment, nor is United Healthcare as a payer going to pay for things like that. And so there's a lot of challenges to get from day 1 to to year 5 in that regard. So to me, it sounds like one of the most important features of addiction treatment for anybody who calls and says 30, 60, 90 days whatsoever, it's not just about day 90, it's on what is now taking place on day 91, 92, 93, and
Absolutely.
so forth and beyond. That it has to have this intentionality about it, but at the same time it's complex, because it feels that patients pull the parachute cord day 30 and feel like they got it, and then don't do any of the work thereafter. So, kind of in closing here, what can we, maybe insist upon or share with families about about these time frames and to really put intentionality into thinking about this in much longer terms, and then creating expectations about what we can do in 30 days, but what the expectation will look like, a couple of years from now.
So what do we tell them in that regard? How do we,
Yeah,
how do we frame that to families?
Exactly.
I think, well, learning how to set measured expectations. And to me, some of that language too is around how do we help families, well, meet their loved one where they are too, and then to me, it's our job at Peaks, it's our job to provide our care, and then all the time when I'm meeting with clients, I'm thinking about how do I help empower our case management team to make sure that as the client transitions from one system and into the next system, that's seamless and robust enough to help people maintain their sobriety from substances and any big relapses in mental health. So I think just helping to cast a vision over the next couple steps, and that it's going to take work. Like this just doesn't go away, even with sobriety. Like this does take some work. Clint,
Yeah, I think I would actually speak to something that you had mentioned a little bit earlier, Jason, this idea of the tiered levels of care and actually educating families on what that is. That recovery is a process, treatment is a process, and this is what the process looks like. And at this moment, you're here in the process. And after you're done with our program, which is this 30, 45-day program, then you will be here in the process. And then after that, you'll be here in the process. So really, breaking it down into realistic terms and what the reality of recovery looks like. That it's not, it's not just hope, right? There's a combination of hope and life skills and behavior and community and there's all of these different levels of intensity. And so really driving that home, that this is, especially when they're at Peaks, they're at the beginning of the process, not at the end of the process. And I think a lot of families are so exhausted by the time they even get to the starting line that they're just praying that it's the end. But being able for us to really educate and provide them with the level of support that says, hey, no, we're actually at the beginning, So, but we're going to tell you, we're going to help you see what that end looks like, and we're going to help your loved one get to that process. But right now, this is where we are.
Absolutely. Well, for a first-time show here, I feel like that was a rather successful discussion, certainly entry level, and I'm sure we could expand on this for hours, but I appreciate everybody joining us today. And it's our intention moving forward out of this beta phase to really explore topics and ideas within addiction treatment and bring that education to families and their loved ones as they seek addiction treatment or mental health services. And so on behalf of Peaks Recovery Centers and my colleagues here, Clint and Jason, wish you all well and signing off.